Well, what we need to do, and this is absolutely critical, if we want to crush this outbreak, we've got to get the overwhelming majority of the United States population to get vaccinated, including, and I might say, even specifically Black and brown people, because of the risk that I showed you on some of those slides. And that was the reason I showed those slides, because of the increased risk of infection and serious deleterious consequences. So what Black churches, places of faith in Black and brown areas should do, since you do have an air of authority, you are trusted. You are trusted so much more than the outside non-brown Black world. So when you get up there and say to your brethren and your brothers and sisters who come to your churches that it's important for you to get vaccinated, that means an awful lot. And they will say, well, we have skepticism about that. And you ask, well, what is the issue? Well, we think it went too fast. And I think, as the governor said, and you may have said, Rob, that speed was related to extraordinarily breathtaking scientific advances in vaccine platform technologies that allowed us to do in months what normally would have taken years. So the next question people ask is, well, is it really safe and effective? I don't really trust the government. They may be just trying to put something over on us, and the drug companies are just trying to make a lot of money. So why should I trust them? Well, there's an answer to that skepticism, and that is that the decision as to whether or not this is a safe and effective vaccine was made by an independent body that is beholden not to the government, not to the company, but to the American public. It's called the Data and Safety Monitoring Board. And they decided that the data was striking, 94 and 95% efficacious in preventing clinical disease. The FDA makes the final decision as to whether it's safe and effective enough to go out to the general public. And here again, career scientists, not politicians, they together with a totally independent advisory committee then makes the recommendation whether the vaccine should go out to the general public. And they made that recommendation. So when you get up there in the church and talk to your brethren, you should be saying that the process was both independent and transparent.